I'm Ron Plants, and leading off at 4:30, there's a growing shortage of nurses and other healthcare professionals here in Western New York, around the country during the pandemic, and it's really stressing out some of the local healthcare systems as they try to fill out vacancies. In fact, the problem compounded for Catholic Health because of a pending strike in the coming days. Last week, they announced that they had actually sent several $million to a hiring replacement firm to deal with the possibility of vacancies when nurses were out on the picket line. As it turns out, more healthcare systems are looking for outsiders to meet their staffing shortages. Beyond the strike replacement agencies like the one Catholic Health is bringing in, there are travel nurses brought in by agencies from other parts of the country to work in local hospitals. And it's definitely another expense for hospitals, which contend they've been struggling financially due to the pandemic and other factors here in New York State.
We have traveling nurses on our staff that are filling gaps, as do every other health system.
So far, local hospital systems did not respond with how many travel nurses they have working for them, but just as they try to actively recruit for their own staff, these agencies are in competition themselves as they use incentives for a new young nurse starting his or her career.
After they completed their orientation at a particular hospital and they're single, it doesn't take much for a travel agency to come and swoop them up and say, look, we'll pay for your meals, we'll pay for your lodging. How would you like to see Miami? Work 7 days on, 7 days off, make $4,000 a week for 13 weeks, all expenses paid. It sounds pretty good.
Ron Plants, Channel 2 News.